Next, the mounting worries and public health concerns over the rise of drug-resistant bacteria.
Now, we want to show you the fast and urgent fight underway by doctors in states across this country tonight. They are trying to contain a new bacteria, a kind of ordinary bacteria antibiotics don't reach, and even the CDC has called it a nightmare.
Antibiotic resistance is one of the most serious health threats we face today. We risk entering a post-antibiotic era where even simple infections can be deadly. With a few bacteria, we're already there.
But we as a society have a looming problem that some of these bacteria, some of the harmful ones, are becoming resistant to our last resort, very best antibiotics.
Antibiotic resistance is the ability of bacteria to become resistant to antibiotics, so the effectiveness of drugs are significantly reduced or eliminated. As a result, it is one of the most concerning public health problems in the United States. Once bacteria are exposed and susceptible to antibiotics, they become resistant through a genetic mutation or by acquiring antibiotic-resistant genes from another bacteria. Different genetic mutations result in different types of resistance. For instance, through some mutations, bacteria become able to produce strong chemicals to inactivate antibiotics, whereas some other mutations can completely eliminate the cell that antibiotics target to attack. Bacteria are able to acquire resistance genes from other bacteria in several different ways. Bacteria sometimes undergo conjugation that transfers resistant genes to another. Viruses can also pass resistant traits between bacteria. When virus attacks bacteria, it can inject the resistant traits into them.
One of the most pressing issues facing the healthcare system is the lack of effectiveness of antibiotics. The rise of antibiotic resistance puts strain to the healthcare system since patients begin to require more expensive treatments as current antibiotics fail to work. According to the Infectious Diseases Society of America, it is estimated 21 billion to 34 billion, and an additional 8 million hospital days are spent annually on antibiotic resistance. Also, according to the U.S. Department of Health and Human Services, it is estimated that at least 23,000 deaths are caused by such infections. Pathogens that cause diseases such as gonorrhea, tuberculosis, typhoid fever, and malaria are among the many that have been observed to develop antibiotic resistance. This growing trend can cause the spread of uncontrolled diseases as antibiotics become less effective. Therefore, slowing the pace of antibiotic resistance will generate a number of benefits to the healthcare system. Methods to prevent this including developing ways to avoid illnesses. Vaccinations, improved public sanitation, and the promotion of living healthier lifestyles are such means to prevent sickness. Healthcare professionals can also closely monitor antibiotic usage and eliminate the unnecessary use of antibiotics by accurately diagnosing the disease and prescribing the correct medications. These measures limit the number of visits to the doctor and reduce the use of antibiotics. It also lowers the cost of producing and developing them considerably.
According to the 2006 National Practitioner Data Bank annual report, there are approximately 15,000 to 19,000 malpractice lawsuits filed each year, most commonly for reasons of diagnosis, surgery, and treatment. According to some reports, the cost and frequency of medical litigation has increased since 1975, due in part to rising costs of healthcare and a changing patient-doctor dynamic. The increasing risk of malpractice lawsuits, as well as the rising cost of being a physician in the United States, is likely one of the largest factors in the overprescription and misuse of antibiotics. The combination of the high cost of doctor visits and a pervasive and unceasing expectation for action and perfection from healthcare providers imposes a great deal of pressure on physicians to prescribe antibiotics even in the case of minor illnesses in which antibiotic medications have no effect, such as the common cold. While the cause of the overprescription of antibiotic medications may be traced to a number of different trends within the world of healthcare, namely an increasingly aggressive prescriptive culture and growing anxiety among patients about the security and competence of the medical field, the cure for overprescription is far from simple. Any number of shifts within the medical field within the United States would be useful in alleviating overprescription and reducing the likelihood of antibiotic resistance developing, such as legislature reducing the number of malpractice lawsuits or better programs within medical schools emphasizing holistic or integrative medical alternatives to pharmaceutical care.